Hello, good morning. Good morning. Welcome to the Empowering New Nurses Show. I'm Dr. Miriam Smith. I'm your host. And I know many of you visiting and you have been coming on, and I appreciate it. Today, we have another guest. Yes, another guest, a nurse, and she'll tell you more about herself. Indeed, she's an advanced practice nurse, and she loves her work. She just has this passion for nursing and to see that all patients receive the best, the high quality care that each one deserves. So this morning, I just want to welcome our special guest. She's none other than
Elrona Smith, registered nurse.
Registered nurse. Now, you have been a nurse for many years. You have been specializing in an area that you'll let the world know about because you have a lot of experience, a lot of knowledge. Now, at this time, can you just tell us a little about yourself?
Well, my name is Elrona Smith, otherwise known as Joy, affectionately called Joy. I'm a registered nurse for over 20 years. I started out, I got my BSN from Herbert Lehman College, and I went on to get my master's from Mercy College in Dobbs Ferry. Prior to that, I did the LPN. I was an LPN prior when I started out, even though I had my BSN, because at the time I wanted some money, so I decided to do the LPN exam, which I passed. And then I started my first job as a LPN with a baccalaureate degree in a nursing home. And from there, I was able to have an understanding of what I'm about to experience at the bedside in an acute setting. So I started as an LPN, and I was serving the geriatric population, which was predominantly adults over 65 and older. And they had other they have a lot of comorbidities. But I was happy for the experience because as a new nurse, sometimes it can be a bit frightening when you are put in a position to throw in a hospital setting as opposed to getting some nursing home experience. So I was thankful for the opportunity to work as an LPN, where I was able to offer evidence practice for my patients.
Excellent, excellent. So you said you were an LPN before, great. But as a nurse coming into the hospital setting, a new nurse, what was that like for you? Was it frightening? Tell us some more about that.
Well, I remember coming, as working in the acute setting at the hospital. It was challenging. It was frightening. It was nerve-wracking because I'm like, oh my God, it's not like the nursing home setting where most of the patients are, just there like for continuity of care. But I was afraid, to be honest. I was terrified to know that this is a different population. I mean, there are people who are more acutely ill. Mm-hmm. We're talking about, you're now on your own. You have to make your own critical thinking. Who you have to prioritize, who needs to be seen, who could be just eyeball, but who has to be watched and who has to be monitored. Because you had the acuity, you had to make sure you were dealing with the acuity as opposed to just routine treatments.
Thanks for saying that. Thanks for saying that. That's a very strong point, because someone might say that somebody has only 2 patients and another person might have 6 patients. However, the acuity determines the quality, determines the care and the frequency and the observation and all of that. So as a prudent nurse, even giving your assignment or delegating to others in the health team, on your team, it's so important to analyze that. And that's how critical thinking comes into play. you have to be able to say, okay, this one needs more attention, this one needs it, and so forth, and so forth. So you have been specializing in a area of nursing. Now we have so many areas in nursing, so many specialties, so many of them, but you have chosen an area that causes someone to consider, and some people might like that area and some might not. But what really motivated or inspired you to decide to, to hold on tenaciously to that area of nursing? What is it? Tell us a little about that.
Okay, and well, initially, I was at the bedside when I became an RN. I was at the bedside for over 5 years in med-surg, and I really enjoyed my med-surg. But for some reason, after a while, I had issues with childcare, and it was either my child or a job that could accommodate, my child and myself. So at the time, being a bedside nurse and RN, I enjoyed it. I loved it. There were moments when it's like you got so intertwined that you were showing more instead of showing empathy. You were like showing more sympathy, and it brought me back to like these are people we are dealing with. These are people we are dealing with, and my concern was if that was my loved one, that's the kind of care I want to make sure they're getting. So it was between a rock and a hard place to leave bedside, but then the opportunity came where I went to utilization management, which is a part of discharge planning, and it was more hands-off, but you were also involved because you now became the patient advocate. Okay. And we had to make sure that the patients and their family were informed. And specifically, my area was more towards the nursing home population. So it helped me to piggyback on the experience I had in the nursing home coming in. I was able to intertwine that into discharge planning, utilization prior, where we would make sure the acuity is there in order for the hospital to be reimbursed, because we know that managed care plays a great role in patients being in the hospital. So I had to be very much involved to make sure that the acuity was there in order for the patient to remain in the hospital so that the hospital could be paid.
Thank you. So it's not just the bedside. So you see, as we said earlier, there are so many different areas, but a population that you care for in your specific area, are they cardiac related, or they're just any underlying conditions? What is there a specific area that your focus is on? Well,
the focus of our position then was we were focusing on the geriatric population of patients coming from the nursing home. However, where I work is on the telemetry unit, which is a cardiac unit. And our focus also was on patient with heart failure. So we had to see exactly when the patient comes in, if they're decompensated heart failure, or it's a history, or it's a new onset of heart failure. And based on that, we would determine, meeting with the patient, we would determine, if they have a PCP, a primary care physician, if they have a cardiologist, and to find out, if they're compliant with their medication, if they are doing their daily weights, to find out those who have scales or those who have scales, and to make sure that they're doing their best to weigh themselves so they could have a better rapport with their physician when they do their their checks.
So that's really interesting, because these patients have to learn to monitor their urinary output, their weight gain, and all of that. So there's a lot of education involved.
Yes,
And
there is. There is a lot of education.
yeah, you did mention that you did advanced education. So was that in education or a different specialty?
Well, that was mostly a part of education because I got my master's in nursing education, and I do believe that I benefit more on a one-to-one basis with my patient as opposed to in a classroom setting. I can really offer myself in real time and can be really develop a sense of trust based on a one-to-one basis with my patient as opposed to a lecturer in the institutions of higher learning.
Thank you. Thank you for sharing. And that comes up to the point where individuals, you have your passion. You know what you do best. You know what makes the clock ticks, right? For you and how you feel. And that's really, really interesting. You mentioned the word telemetry. And for the general public, they might not have any idea what that entails. However, does that mean that it's a special unit that would have patients on monitor or something like that? Do you have any idea, or you want to tell somebody, a layperson, when they come in, why is it important that you just mentioned a cardiac care and the scale and all of that setting? There are times when these patients, they come back in and they're really, say, unstable, and they have to put them on a monitor. And so on that unit, you have many patients who are what?
Monitored.
Monitored. And that means that they are hooked up to a machine.
Yes.
And it's hooked on there, and the heart would be monitored, and someone would be there constantly.
Yes.
Observe if there are any changes, if any condition changes with the rhythm.
Yes.
Because there are certain rhythms that are normal and there are others that are not. So they are constantly being monitored.
Yes.
Wow.
Yes. Yes.
So it's important. And so forth. Therefore, the family members need to be what?
Educated of what's going on and be updated. Because it makes a difference. Because I've learned when a patient is sick, then the entire family becomes ill. It's like a domino effect. It's a domino effect. It spreads. So yes.
I know that so often we have in services on the units and so forth. Well, have you observed anything that you've observed? We come into the end shortly, but like just for the general public to know, our young nurses are coming on. Many of them are excited, but then you've seen some, and the interest might not be as much. Others might have preceptors that they're not too sure of what's going on. But from your experience, can you let us know some of the things that you have observed, about some of the new nurses, and also what some of the tips you would want to tell them so that they can continue and don't get burnt out and just decided that, no, they're not going to continue nursing?
Well, what I would tell my new nurses is to be vigilant, not to be afraid. It's just putting together all that you have learned in school. You're now applying that in the real world. And I will also encourage them to document. Documentation is paramount because as the saying is, if it's not documented, it was never done. And sometimes with good intentions, we meant well to, document that the patient reported that, haven't had a bowel movement in 3 days. And we like, yes, I'm going to write it down. But then we get distracted and we forgot. And then something happened. And then it's like, oh, it's not documented. So the importance to all new nurses is just to do your assessment, do your own assessment, do your rounds. I believe in doing walking rounds, lift up the sheets. Don't be afraid to lift the sheets and look to see what's under there. I've had experience in the past where the report says patient has on Vinodine boots, but when the patient came to the floor, they were bilateral amputees. So I believe in still lifting up those sheets, do your own entity assessment and see and document, because if it's not documented, it was never done. So that's my little tidbit to all incoming nurses. make sure you document.
Wow, awesome. In addition to that, I would add that from my observation, over the years, encourage my nurse. Some of them are really, really fearful. Yes. In addition to that, be visible. Be visible, because your patient might at this point might be stable, and teamwork is so important. Another patient might be unstable, but that patient is not your patient. However, we have to be mindful of our colleagues as we work as a team. And so doing, you're going to participate in helping that patient's recovery, and because your time going to come. But apart from that, when we care for our patient, it's patient care center we're talking about. So when we care about each other, your work shouldn't be so much that you can't even go to the bathroom and the other person is just relaxing, So it's so important to be mindful of each other and have a team-based mindset.
That's correct.
A team-based mindset.
That's correct.
Work as a team for the good of the patient.
That's correct. And also we have this old adage, as nurses, that nurses eat their young ones. And I had a conversation recently with a colleague, and I'm like, you know what? We need to reverse that. We need to really reverse that nurses eat their young ones. And instead of eat them, let's teach them. Let's teach our young ones, because remember, we were once young also. And we just went into nursing and overnight we got it under our belt. It was a gradual daily learning. It was cumulative. As you go along day by day, you learn, you grow stronger, you acquired more skills, and you built on your critical thinking, and you became the nurse you are today. So we need to go back in time and remember when we first started, how naive we were, how timid we were. But as time goes on, we became expert in what we do. And let's not eat our young ones, but let's teach and nurture them, because that's important in the field of nursing.
Nurse Smith, thank you so much for those tidbits. They're vital.
Yes.
Because from your experience and from my experience, we know that there are times we met bullies.
Yes, indeed.
And bullying is a big thing in the nursing.
Indeed.
And if the truth be told,
indeed,
although we have some of the best, the exceptional nurses who are willing to share or impart their knowledge, there are others who are not like that for whatever reason.
Correct.
So we encourage self-care, an inventory of ourselves, checking ourselves first, see where the problems are, so that we don't have to take our problems to work or put it out on others.
That's correct.
Examine and implement, act on caring for yourself, identifying the problem, and then mend it, and then you'll be able to offer the best care to others, to your colleagues. You don't have to be friends.
That's correct.
When it comes to the patient care, it's important.
It's teamwork.
Important, and it's team. So be a great team player. It's very, very important.
Very much so.
I know many of our young nurses are listening right now.
I hope they are. I hope they do.
I know they are listening. And some of them know you, and some of them might know me also. But let me let you know that it was a pleasure to have you on this Empowering New Nurses show. It has been a blessing, because many individuals have said, wow, reinforcing certain skills, reinforcing certain information that will help them and guide them, so that freely they'll be able to communicate with their patients. On my line, I have areas where therapeutic communication. I have areas where we don't want to embrace that at all, non-therapeutic. So, but in therapeutic, let your patient sense your presence. Listen to your patient, actively listen. Listen to your patient. So all those factors are elements. Again, culturally sensitive care. Each person is different, and their preferences and their individualization are important. Right?
Yes.
So when we think of a patient, or we're caring for a patient, we're not caring for a group. We're caring for one person. And there are so many things that we have to bear in mind. Their culture is so important.
Yes.
Give that individualized care.
Yes.
Therefore, if you don't know that information, or I don't know it, it's my responsibility to research it.
So true. So true.
And get
Research.
sure that that patient will be
Yes.
able to receive the care,
Yes.
the high quality care, because
Yes.
that's all a part of it. When all the pieces put together like a puzzle and you get that, it's great. So let me say thank you for coming on, for taking time out of your busy schedule. We appreciate it. And I want to wish you all the best for this season. This season, which is a giving, a time of giving, a time of sharing. But
Yes.
you know, we don't wait until just this time to offer. We do this continuously to our patients and to others.
Yes.
So may we emulate the best, and may the young people emulate the best nurses, the qualities,
Yes.
so that this noble profession can continue to progress.
Indeed. Indeed. Indeed.
How will you contact me, or others will can connect with me? YouTube and Miriam Amanda Smith. On podcast, Mir on Instagram, Miriam Smith on Spotify and on Apple. So Instagram. So I know some have not yet subscribed. I know, and I know you're going to tell somebody to go check that Empowering You Nurses show and subscribe and tell others. There's much to learn.
Indeed,
and guess
there
what?
is.
Whatever topic someone wants, we can discuss it. And of course, we share. So we have our young nurses. We're empowering the young ones. We're empowering the new ones. We're empowering the seasoned ones. We're empowering the old ones. We're empowering the retired ones, because guess what? We pass on information
Yes.
that will help
Indeed.
another generation, the next generation.
Indeed.
So in 2 or 3 words or sentences, just give us the last charge before you leave.
Well, to all the oncoming nurses, I just wish you well, and just believe in yourself and always listen to what your patient tells you. It's very important, because it's their body, and they know their bodies better than we do. And always give a listening ear to them. And touch is still important. It's still therapeutic, touch, even though I know sometimes you're afraid to touch because of lawsuits, because of the reality, but still touching is very therapeutic. It makes a difference, that touch from the hand. Yes.
Thank you so much again, Nurse Elrona Smith, for coming on. And may you continue in your great work and continue to inspire the younger nurse. Thanks for your contribution to nursing.
Thanks for having me.
And thank you for inspiring me along the way. For my accomplishment, I will never say you haven't been a part of it. I am grateful.
Thanks for thanking me, Dr. Smith.
All
Absolutely.
right.
Thank you. Be well.
Have a great day. Enjoy the season.
Likewise. Thank you. Bye-bye.
Bye.